Welcome back to the show. Many thanks for staying with us. Last week, it was the death of a baby as its pregnant mother struggled to cross a river to give birth in a health facility cut off by the floods in the northern region. That incensed many who thought that shouldn't be happening in this day and age. Listen to this and your anger will go through the roof. It appears the situation is much worse than we earlier heard. As many as 5 women have died this month alone trying to access health facilities to give birth. Northern Regional Correspondent Hashmin Mohammed reports.
It was around 5 p.m. My wife felt pains, and we decided to send her to Kubori on a motorbike. It took us several hours to cross to Kubori Clinic. Because of the bad nature of the road, we fell down on the motorbike. When we finally managed, I am very sad because I have lost my wife and a baby at the same time, even though it is a will of God, but the bad nature of the road and the flood caused it.
Sincere apologies for that poor audible, for that poor sound there, but let's get to correspondent Hashmin Mohammed and speak to him so he can tell us what really the story is. But we'll work on that and bring you that story. Hashmin, I see from the visuals that you sent us that it took a while to get to this village. Hashmin, can you hear me?
Hello?
Yes, Hashmin.
Yes, I can hear you.
I'm saying from your video that it did take a lot to reach this community.
Well, on a motorbike, it was almost an hour journey, and finally we got to the stream, and we struggled to cross through the stream before we could access Naguma community.
How did you cross the stream? Were you also carried?
No, this time around we were not carried because the volume of water at that place had gone down. Right. And because of that, we were able to walk through, but it wasn't easy walking through the stream because there were certain points, the more you walk through, the more it goes deeper.
So you get to this village, what is it that they told you?
Well, when I got to the village, one thing was very clear. For the residents, they were happy that we have visited them. I could hear from the background from the residents that once it is a JoyNews, they believe that their facility will now be open for them to use it. And we finally got the lady who lost her baby in the field there.
So now, let's get to the story of this woman. She lost the baby. How is she doing now?
Well, generally, she's very calm, even though she's traumatized by the incident that happened last Sunday. But she's saying that the issue could have been prevented if authorities had constructed better roads across their community and the community clinic, if they had opened it to them to use it. And she's not the only one who has lost her baby. Yeah. Maternal deaths in that particular community is very, very high.
Tell us about this situation. How many people have died? We're reporting that 5 pregnant women have actually died, either lost their babies or they died because they weren't able to access health care and on time. Tell us about that particular situation and how bad is it in this community?
Well, according to them, this year alone, they've had about 3 people dying trying to access health maternal health care in nearby communities. And there are several others who have gone missing after the spillage of the Bagri Dam. Others too, they felt sick, they couldn't cross, so they pampered them with herbs and managed them to die at the community, and they buried them. And those are numbers they have not revealed to authorities. So they are saying that in order to prevent the situation there is the need for their clinics to be open, and government should also try and construct a bridge across the stream. They are saying that it has been a perennial issue every year. Issues related to death associated with flooding is always recorded in the community.
Well, Hashmin, thank you very much. We'll work on that sound in that report and bring it to our viewers so we can take them directly to the community so they have that experience. Hashmin Mohammed is our correspondent in the northern region. He's been to the community in Nangruma where that lady lost her baby today. And as you heard, it is not peculiar to her. About 3 more people have died this month alone, they say, trying to access healthcare. Let's speak to the national chairman of the Ghana Coalition of NGOs in Health, Dr. Gabriel Banaku. Doc, I'm curious to find out what you make of this situation.
Yeah, good afternoon.
I'm curious to find out what you make of this situation.
Yeah, good afternoon. And then I'm greeting everybody in the Ministry of Health, Ghana Health Service, and the general public, especially the people in the northern region. There are 2 critical issues we want to go straight to the point. The first one is that Ghana is not financing our emergency response program. And that is the effect of what is happening across the country. That's number 1. Number 2, Ghana is not responding to the needs of the people who need health care. And that is the effect we are getting. So the 2, let me take them one by one. We are not responding to our emergency crisis because we have poor leadership commitment. We have said this over, and if you listen to the coalition position over the last 4 years, you will see that the coalition has always talked about the health leadership. The leadership in the health sector needs much to be desired. We need somebody who will want to go all out to say that this thing must stop. This is the country that, by WHO standard, which we have signed on to, by our own national emergency response, we have developed policy. By our own national budget, we have emergency response budgetary allocation. Where are all these to allow the vulnerable people we claim to seek, protect, and support to have access to quality of care, and this is happening to them? The emergency response will have stopped all Ghanaians, not even the sector ministry, all Ghanaians, including the Ministry of Food and Agri, the Ministry of Health, Ghana Health Service, that every year these crises come in the north. This Bagri pillage always happen every year. It is normal and it is a common sense that this happens every year. So why are we pretending as if it is just an emergency situation?
So at this point of our lives as a nation, where we're still having to deal with this, what is your expectation? I mean, what are your suggestions as coalition of NGOs that we did? And who is even going to exert pressure on the authorities to get this done? Is this something that your coalition can help with?
Yeah, the law is very clear. We have the NAMO, we have the Minister of Food, we have the Minister of Finance, and we have the Minister of Health. That they are mandated to know that this happens every year, and our emergency response strategy know that this will be happening. So they must, and we will continue to talk about it. So that is you and I, our role. The coalition will be advocating to ensure that government officials really do the work by what they talk about. The other aspect is that the Ghana Health Service can do better if they are financed. And so we'll continue to talk for an increased budgetary allocation for the Ghana Health Service so that they can be able to respond in terms of this.
Right.
The third one is that where is this drone system that the ministry launched recently? The drone system, we praised them for that, and we said they should learn from where it has been initiated within the sub-region and learn from how we can use that to respond to emergencies. Not only blood, not only just responding to shortage of blood we must have an integrated drone system where the drones should be able to evacuate to a nearby center. We need to activate our national surveillance system where volunteers can really draw attention of the drone center for them to respond to emergency crises. That is how the drone system has to work. That is how our national health emergency response has to work. Not to launch them and keep quiet and allow people to die.
Right. Dr. Banaku, thank you so much for your time here on The Pulse. Dr. Gabriel Banaku speaks for the Coalition of NGOs in Health. We'll bring you the story from Hashmi in our subsequent bulletins.